When it comes to managing pain, where do you start when a patient comes to you?
Right. When a patient comes into my office, I want to start with a standard in-depth history and physical examination. Pain is a symptom. It's not always a disease in and of itself, although it can become one. So we need to rule out any acute or problematic medical conditions that could be life-threatening or life-altering. So we start with that. And then we set goals with each other. I need to set goals with the patient needs to set goals with me. So I want to ask the patient what's important in his or her life. What do you like to do? What can you not do that you used to be able to do that you want to do again? And that's so important in our disease process. Many of us get this diagnosis of spondylitis. We get frustrated. We look at our lives as being over, and it's not. We just need to see what's important to somebody and how to get back there. So we want to set physical goals. If a patient states to me that she likes to spend time with her children on the playground or walking her dog, then we're going to set realistic goals. Setting a goal for running a marathon within a month is not really attainable for most of us. But setting a goal to walk into one's mailbox might be, or taking one's dog in the backyard. That's a realistic goal. And I think physicians also have to hold themselves to realistic goals. If a provider or a pain physician tells you, my goal is to make you pain-free, it's probably unrealistic. And if they tell you that you're going to be able to do something that you haven't done in 20 years, that's probably also unrealistic, although not unheard of. But if you sit down with your pain provider and say, hey, I want to spend a little bit more time at Thanksgiving with my family, how can I do that so I don't get so uncomfortable sitting there? Then we can work on those goals. And I think that's imperative for us. If physicians don't take into account patients' overall psychosocial, which means their overall role in the family or psychology, or what makes them stressed, what helps to alleviate them stress, we're probably not going to get very far.
What does managing pain mean to patients versus means to doctors?
Right. Managing pain often means to patients, I want to be pain-free. Managing pain to doctors also often means, how can I get this patient to get to a state where they may not need me all the time? And neither of those is usually congruent to good pain management. As we alluded to a little bit earlier, managing pain really needs to be some sort of return to function. And that's the whole reason we do pain management. If we're going to do pain management just to say, I'm going to make you pain-free while you sit and watch TV, but you're not doing the things that you need to do to function in your role in society or in your family, then I haven't done you any good. And the patient hasn't, and I haven't done any good to the patient's family. So we need to really hone in on, how can I return you to some modicum of role to what you were before this disease took its toll upon you.